The subcommittee will come to order. Good morning, and thank you to the witnesses here today to discuss biosimilars can lower costs for patients and provide greater and more affordable access to care. As we discussed in our first subcommittee hearing of this Congress in terms of our national issues and chronic disease epidemic, it's extremely costly just in terms of the healthcare system, but also our fellow American patient. In fact, 90% of our $4.5 trillion in healthcare costs last year was tied to chronic diseases. It's hard to believe, but they're saying 90%. 42% of Americans have 2 or more chronic diseases, such as diabetes, cancer, heart disease. Today's hearing is an important step in lowering health costs and improving our outcomes, and we must continue to find longer-term ways to improve the health of our patients and our nation. Thankfully, we live in an era of innovation where researchers and manufacturers are developing new and complex treatments and cures. Medicines such as cell and gene therapy, these drugs have improved millions of lives for patients with Alzheimer's and other diseases. We also are able to bring these treatments to patients through lower-cost biosimilar options. Since entering the market in 2015, biosimilars have saved the entire healthcare system over $23.6 billion. Within the medical program, the biosimilars reduced Part B spending by $4.5 billion in 2020 alone. Biosimilars launched at prices up to 35% lower than branded drugs, and they can drive further savings when they compete with drugs already on the marketplace. The marketplace competition, lower costs for all patients in the insurance markets will provide safe and effective treatments options for patients. Biosimilars also help increase drug supply and availability and have been used in nearly 700 million days of patient therapy. Still significant work needs to be done to ensure this in terms of moving forward. This ranges from making our drugs reimbursement systems work correctly to incentivize markets competition to improve patient and providers' education and awareness. Our healthcare system stands to save $181 billion over the next 5 years by reducing the barriers to biosimilars adoption, and I hope this hearing can help accelerate that goal. We are about to hear from a great group of folks who represent many aspects of the biosimilar market, including those involved firsthand in the care delivery and those working behind the scenes to bring about these drugs to the marketplace. I look forward to working with all of our colleagues with Congress to reduce the impact of chronic disease epidemics by making innovative treatments more accessible and affordable throughout the biosimilars. So with that, I want to introduce the gentleman from Texas, Mr. Doggett. Thank you.